So I'm here with Dr. Ken Schiffman, who is a board-certified orthopedic surgeon with Hinsdale Orthopaedics and who just recently returned from a mission trip in Haiti and caring for victims of the earthquake that was there. Dr. Schiffman is known for his excellent work treating shoulder injuries here, but did a lot of trauma cases there, it sounds like, and infections. And he's going to tell us a little bit about it. What was the most condition that you saw the most in Haiti?
Well, what I saw the most of were infections, musculoskeletal infections, not just arm but also leg and foot infections, as well as trauma, injuries, and mostly injuries that had been neglected because the access to care is so limited.
Was it what you expected it to be?
I don't know that I had an expectation for what Port-au-Prince was like, but I think the kind of work we did there, that's kind of what I expected it would be.
What were the challenges?
The challenges were physical plant, just facilities. The hospital that we worked at was what remained of a hospital that for the most part collapsed, and so we were working in very temporary facilities, working outside a lot. Our patients were in beds under canopies outside, and if it's hot here, it's even hotter there. So patients were in beds with early surgical wounds in the heat. It was difficult. It was difficult to work in the operating facilities we had because those were temporary, makeshift, and also very hot.
Were you able to treat all the patients that you wanted to treat?
No, we were not, and that wasn't far from my expectation because again, it's always much more difficult to go out of what we're used to into the third world and work. I mean, there aren't the kind of efficiencies that we've just grown so accustomed to. So we got a good amount of work done, but not nearly as much as we would have liked.
What was the most rewarding aspect for you?
The most rewarding aspect was to see patients heal. I mentioned that we saw a lot of infections, and again, we take that kind of thing for granted, certainly in our society. But there were a couple of really severe infections that even through the course of a week, I was able to see get considerably better, and that was rewarding.
Makes you feel good afterwards that you've made a difference for them.
Right, at least for a few.
Mm-hmm. And goals from here on in? Would you like to go back there or look at other countries?
Yes, I think that this kind of work that is volunteering orthopedic services in the third world obviously is needed. There's many opportunities, many different parts of the world, and there are different organizations that organize and foster this kind of work. A year and a half ago, I was in South Africa with an organization called Orthopedics Overseas, and what they do, which is really great, is they really work hard at building sustainable programs. So, they try to send North American surgeons to different sites to teach, share some of the skills that we've been lucky enough to develop, and hopefully leave their situation better with medical practitioners who can carry on.
And here you have the Dr. Schiffman, the philanthropic side of you, and just returning from Haiti, and it sounds like you've had a lot of other mission trips in the past and are looking forward to more in the future. And you're a shoulder, elbow, and hand surgeon here at Hinsdale Orthopaedics and practicing out of Hinsdale Hospital and Good Samaritan Hospital in Downers Grove. Anyone can book an appointment with you through your website or by calling 630-455-7135. Thanks so much for joining us.
Sure, thanks.
I think that was too rough.